Hello and welcome back to Time with Dr. Racheal. So today I will just stick to treating fibroids. What are fibroids? You know that already. If not, go to our previous videos. So basically, we're treating fibroids today. And fibroids are just like benign growth, abnormal growth within the womb of women, usually during the reproductive age group. And of course, being a woman already puts you at risk for fibroids. Now, for us to be able to treat fibroids as an entity, we need to look at the number of fibroids, the size, and the location, and how it has affected the patient. Now, so if your fibroids are less than 3 centimeters, that's really small, maybe single fibroids within the muscle of the womb, not causing troubles, not causing pain, not increasing your bleeding, it's okay. You may just observe. Your doctor will give you routine checkups, maybe 6 monthly, yearly, to see how you're doing. And if you had any reason to do any ultrasound scan, they'll also pay attention to the fibroids and all. But if it is causing symptoms, like heavy menstrual bleeding, we need to check how many fibroids, also the location and the size of the fibroids. If it's just a fibroid within the line of the womb and it's really small, less than 3 cm, or really small fibroids, you could go in for a regular checkup with your doctor. And if it's possible, there could be what we call an office procedure, where the fibroid could just be removed. Even during, we could plan on how it could be removed very easily, just like a simple evaluation, looking at it with the pinhole camera and taking it out from down below. But if the fibroids are large, causing a lot of symptoms and causing you heavy bleeding, there are times where we have to give you medication, sometimes to shrink the fibroids while we plan for something more serious like a surgery, or just to treat the bleeding symptoms, if you're with me, by giving medications to reduce the blood flow, the heaviness, or even the periods with which you bleed during your periods. Sometimes, based on the size of the fibroid, the location of the fibroid, the doctor may advise for you to have like a device within your womb to help to reduce the growth of the fibroid, if the fibroid is within the lining, or based on your symptoms. I keep going back to that because there are times where you don't need to do anything. I had a senior who would say, doctors just like to do something. Sometimes you don't need to do anything. Sometimes you just need to speak with the patient, reassure the patient about her symptoms and what is best to do. Sometimes you need to change your diet. Yes, that's simple. Have you observed? Tell me. I'm not going to tell you what to do, but have you observed that when you take certain drinks, or when you eat certain food, or when you lose control of your diet, you seem to bleed heavier? If yes, drop it in the comment section and we'll talk about it. Is that okay? Good. Now, you need to also, diet, exercise, some lifestyle modification on the kind of sanitary pads you use. Do you use tampons versus general regular pads? And how has this been for you? All of this, because when you're trying to treat a problem in terms of in the medical space, it's not just the problem. How has this affected your psychology? The heavy bleeds. It could be so bad that some people have anxiety before their period starts and they're just so worried. Or you have a very big meeting and, oh my God, I cannot afford to have my periods. That's really affected you it could be so bad. From a scale of 1 to 10, it could have been as little as 1 or even 0 and be so high as 10. And so we need to bring in other professionals who would deal with the psychological part of this, your lifestyle modification, your routine meds, your support team, and you may even have to be in a support group of people who actually are experiencing symptoms from fibroids and how they have been able to manage. Now, outside all of this, there is the medical aspect where you use medication, where we play with hormones to help to reduce the size of the fibroids, or when you could actually have a more specific management as to removing the fibroids. And I know the next question is, doctor, will it grow again? Sadly, yes. Fibroids are benign, they are not cancer, but they will grow again. And that's why I would always say, what is the fibroid causing for you? Has it affected you in any way? How bad are the symptoms? Do we need to take it out, or it has to be us reassuring you? All of this is all dependent on the size, the site, its location, and how it has affected you. So it's a tailor-made plan. Don't tell me, oh, my cousin had fibroids, she had surgery, so I want to have surgery. And your fibroid is like 1 cm and it's really small and it's not even anywhere, that would cause problems. Please leave the fibroids alone. Because do you know why? Surgery also has its own downside. And you do not go on to have a surgery when it's not needed. So we always weigh the advantage of a procedure over the risk to the patient's life. So it's like a risk-benefit kind of scale. And so as clinicians, we need to discuss all of this with you and look for what is best for you. So tell me more about how you feel about this video. Tell me what your experiences have been with uterine fibroids and how the journey has been for you. And I'll be happy to answer all your questions. So please send in your comments, turn on your notification buttons, and click on like, and also subscribe to our channel, and you get more from Time with Dr. Racheal. For now, I'll say bye.